Okay, PARCA Clinical Section 3.2 covers contrast risk, claustrophobia, metal risk, and study length. Let's get right into contrast risk. Exams that involve contrast, either ingested or injected into the patient, have a risk that the patient will have a reaction to the contrast agent. And contrast reactions are classified as mild, moderate, or severe. Mild would be some itching on the skin, some nausea, some vomiting. Moderate would be severe vomiting, dyspnea, patient has trouble breathing, and laryngeal edema, which means the patient feels like their throat is swelling shut. Severe would be pulmonary edema, their lungs start to fill up with fluid, cardiac arrhythmias or arrest, heart attack. That is definitely severe, and that is that's a major problem you would be calling a code in the hospital. Claustrophobia is an intense fear of enclosed spaces, and this can be an issue for patients having an MRI exam. And if you've never seen a patient in a head coil, that's what it looks like. So if you have an MRI scan of your brain, they put that cage around you before they send you into this long tube. You can imagine how somebody with a fear of enclosed spaces might not tolerate that well. So they do have things called open MRI where the tube is more open. So that would be, you'd want to send patients with claustrophobia to an open MRI, but that's not in PARCA, and I should stay on topic. Metal risk. An MRI machine is a very powerful magnet capable of lifting an average-size automobile. It is a super, super strong magnet, and as you can see, it has lifted this 400 or 500 pound bed like it's nothing, and it probably flew across the room and crashed into the magnet. So you don't want anything external metal, external oxygen tanks, IV poles, beds. You don't want to bring any external metal anywhere near the magnet when it's on because it will become a projectile. Equally, if not more important, is you don't want people who have metal inside them to go into the magnet because that metal will be ripped out of their body, and that would be bad. And so here's a generic MRI patient screening form, and you can see all the things that might be made of metal or contain some part of metal, and you wouldn't want those people to go into the MRI scan room. And if you look down here, you'll also see that no one should enter the MRI scan room with any of these pieces of metal on. And if you're at the hospital late in the evening and they need some lifting help in the MRI scan room, they will ask you to empty your pockets before you enter the scan room. Or if you go to the scan room to fix a monitor, or there's a problem, you will always be stopped by the MRI techs, and they will make you empty all of your pockets and turn them inside out so they can see you don't have any metal before they let you in the scan room. So don't be surprised if that happens. And again, I've gone off topic, and I should just stick to the PARCA material. According to PARCA, this is the study length, and if you can't tell from these study times, their idea of study length is just the scan time. So you look at CT, and they say a CT scan takes 10 minutes. That's not talking about the time to check the patient in, to have them fill out the forms, to start the IV. They're talking about just the scan time. So here you have it. CRDR is 15 minutes, CT is 10 minutes, ultrasound 20 minutes, nuke med 60 minutes, mammo 30 minutes, PET 45 minutes, and interventional exams 60 minutes. So that's what PARCA says the study length is. So that's what it is. Okay, thank you for watching.